Okay.
I think it's
All right.
good.
Is this okay? Can you hear me okay?
Yes, I can hear you.
Okay, awesome. Well, thank you so much for taking time out of your day to speak with us and help us learn more about why it's important to have good workout shoes. At Slade Fit Club, I'm a huge advocate. Tons of my clients know that I basically will call you out when I think that you have terrible shoes because I really, truly believe that it's super important to have the right type of tennis shoe when you're working out for stability, ankle stability. When, you know, and my style of training, we have lateral movement, up and down movement, things like that. So, I wanted to hear from you, just, you know, from your profession, you know, what do you find with some of your clients? Maybe what type of shoes do you normally recommend? I also think that when our foot is stabilized, you know, injuries can happen when it's not a good shoe versus having that stabilization in our foot when we're working out. Our legs end up working harder, things like that. So, tell me a little bit about what your take is on this topic and some of the most common injuries you see from wearing poor shoes.
So obviously this is a very common thing I see on a daily basis with my patients because usually I see them when there's already a problem, right? And so I always try to give them education as far as how to prevent the injuries. Once we treat the injury, you know, a lot of people think, well, I'm better, I can move on. And so that's the thing. It's not that you're better forever. You have to do things and change things, habits that you do on a daily basis to prevent injuries. Again, very commonly, I have patients that come in and they have, you know, a stress injury. And a stress injury can be in different forms. It could be a stress fracture to the bone. It could be a stress injury to tendons, to ligaments. It could be capsulitis because there's repetitive stress in one place, in one area of the foot or knee or ankle, whatever, any lower extremity part that you might have a specific issue could be because you're just having a repetitive strain to that area. So I always I start with the shoe, something very basic that people forget for some reason is shoe gear. They say, okay, I have a tennis shoe and that's all they need. But it's not only about having an athletic shoe, it's having the correct type of athletic shoe, number one. And when you have that correct athletic shoe, to replace it on a regular basis. Another common view is that I have patients and they say, oh, I have Brooks, I'm fine. And my follow-up question after I just took a glance at them, how old are these shoes? They say, oh, I got them, you know, about a couple of years ago. And I'm thinking, well, there's number one, we have to start with that. If we don't change shoe gear, I can give you medication, I can give you an injection, but if you don't change that, you're going to come back to me eventually because that's what you have to change. So I
Kind of like
educate patients.
tires. Like you have to rotate or get new tires on your car. You
Yeah,
have to get shoes regularly. They only are last so many miles, you know.
yeah.
That's something I definitely speak with about my clients about.
Yeah, and it's good to have trainers like you that are looking at that, and you know, because if you're looking at a form and doing a certain exercise, and you see that the form is off, you can just look at the lower extremity and how it's aligned, and the ankle. You
Yeah.
can see if one is going in, and of course, that's going to cause strain on a joint that's not in good alignment.
Yeah.
So it's good to see that and have somebody like you that's actually seeing that for them.
Something
So
that's really common with that is when people step and they have a high instep, their foot rolls in, which I feel like creates tension on that ankle, or you know, and then all the arches, you know, all the muscles and tendons and things that are going on with that arch, and then you know creates. I mean, it can create shin splints. I mean, you know, but I mean, I see that. And I'm like, you've got to get something a little more stable that's going to support your arched foot.
right, and the right, and so a lot of people. So, well, how do you know if a shoe when it's time to replace a shoe,
Yeah.
right? So that's another common question. Is and the typical, and you'll see it everywhere online. You know, the 300 to 500 miles, and a good analogy, like you said, is tires in your. I always tell them, look, you can drive a car without any threads in your tire, but that's going to cause a lot of problems for you in the long run. Same thing with your shoes. You can walk with these shoes and you can exercise with them, but if you do not, if you continue to have it with no support, then eventually it's going to catch up to you. So technically, you know, so 300 to 500 miles is time for a replacement of shoes. Now, most people are not counting their miles. So another way I say is, okay, let's say that you're working out for 30 to 40 minutes, 3 to 4 days a week. You should change it every six months.
Yeah.
If you're working out every day for an hour, you should change your shoes for every 3 months.
Yeah.
And that seems a lot, you know, that seems like, wow, you know, but it's so worth it because it's going to avoid injury. It's going to have you, I always tell, especially my younger athletes, like the kids that don't want to not, they don't want to miss a practice, or they don't, because they're, you know, and they're injured. I say, look, it's good to really do what you're supposed to do right now, so then you can move on and have a long-term high active lifestyle that will help you to be there if you're not injured. If you continue to be injured, you're going to have setbacks constantly.
Yeah.
So, you know, so the shoes, like I said, that's kind of a general time frame that I tell them that they should change it. Also, look at your shoes, you know. Another thing is, what kind of shoe are you going to get? So I always go over brands, and, you know, Brooks and New Balance and Asics. Now, with each brand, there's different models. And this is when it gets a little trickier for people, because for example, an Asics GT2000 model for that is for an overpronator. So if a person that, like you said, walks like this and gets that shoe, it's going to even put them more stress. So you have to be really mindful of the way you stand. And you can take a look, if you look at a way of knowing without going to a specialist, if you look at your shoe, the wear of your shoe. So if you look at the heel, you can see how you heel strike. So if you heel
The sole, like where it's worn on the outside, or even the bottom tread, you can see maybe where it's ending up smooth and doesn't have as much tread or grip.
Right. So you can see it, that's how you would know, okay, oh, it looks like I'm wearing off more on the outside. So I tend to what's called supinate, which is landing on the outside of your heel.
Yeah.
Or if you see that the wear is more on the inside of the heel, then that means that you strike that way and you're overpronator. So you need a shoe that's going to put you in that neutral position that will avoid compensation. So every joint in our body is supposed to be in a neutral position. That's the most effective way that a joint is going to function. But most of our joints are not in that neutral position, unfortunately. So what happens is our body compensates, and compensates is good, but then bad, because compensation leads to, okay, your body knows, oh, I can't go that way, I have to go this way. So other tendons that are not supposed to be firing at that moment are firing and trying to keep up. And so what the shoe does is eliminates that compensation for you. And so then there's no strain in the tendons, no strain in the joints. And in the long run, that's going to save you a lot of heartache, especially, you know, early arthritis that people get that are very active. You know, we tell patients, we have to be active. It's good for your health. It's good for so many different things. But then if you're very active, you're more prone to injury because you're more active. Your joints are getting more stressed. But if you do it in a safe and smart way, you should be able to be active as long as you would want to. It's as long as you're wearing a good supportive shoe, good sometimes even orthotics. If the shoe is not enough support, then at that point we get more in depth with, okay, do you need something more in your shoe?
It's kind of people don't know, orthotics is like a customized insole you can just slide into whatever pair of shoe or tennis shoe you have, that just gives you the best support based on your foot anatomy, basically, right?
Right. Yeah. So an orthotic is a prescribed insert. So there's inserts, you know, you go to HEB, there's inserts, Dr. Scholl's and all that. And those are usually tell patients is a waste of time and money if you get those, because they're too soft. Another common thing is, another thing of looking at a shoe, if it's a good shoe, is the flexibility of the shoe. So that's another way of looking at your shoe. I always grab patients' shoes all the time, and I grab my little shoes and I'm like, if my little hands can do this to your shoe, that's
Yeah.
not a good sign. Your
Yeah.
whole body weight is going on this shoe or insert. And so you want something that's going to hold up your whole body, 140, 200 pounds on
Yeah.
these inserts. You want stability. So you want something firm. So orthotics are the custom made form from like those Dr. Scholl inserts that you get. They're usually prescription, but there's some great stores in Austin that have off the shelf inserts that I recommend when if you're not ready to invest in a custom orthotic. You know, there's some off the shelf inserts stores like Instep, Caravel, the running company. They have inserts that are good, and you can put them in your shoes, and that will even get your foot at even better position when you're not your. I'm just saying foot, but it's really your whole lower extremity.
Yeah,
That's
100%. So what you say about that, going back to just like you being able to bend that shoe, I see a lot of the time of the type of material that is on top of the shoe, whether how flexible or a little bit more of a, I would say like a sturdy material instead of the soft, stretchy material where, you have the sole of the shoe, you're looking here, when we're moving, your foot is moving like this inside of it. So
yeah.
just using that kind of material on top that's holding the shoe, not including, including the stabilization underneath.
Yeah.
But
And I'm
also
not, yeah.
are a big factor in regards to like injury, shin splints. I mean, I believe that everything is connected. So if you're having knee injuries, you might look below your knee injury to see what's happening with the foot or ankle, and maybe like you're saying, areas of the foot that are getting more work that shouldn't because they're not in a neutral position.
Right.
So,
Yeah.
yeah.
That's so true. Again, I'll have patients that'll come in with plantar fasciitis, and I give them some recommendation of support and shoe gear and inserts, and they come back for follow up and they say, yeah, I'm better, but guess my back is much better too. Or they'll say, oh, my knee is much better after they have had treatment, after they did a scope in their knee or had steroid injections in their back. And like, that's amazing. I'm like, yeah, of course, it makes sense. Everything's connected. So if you're walking, like I said, I can give you an injection, I can give you medication, and it'll get better. But if you don't address the way you're standing, it's not going to improve your stability. I always compare inserts and good supportive shoes like with glasses. Like we get glasses to improve our sight. We take these glasses off, I'm back to being blind. Unfortunately.
Well, I've got to wear my glasses to be able to
Yeah. So same thing. Inserts shoes is to improve gait and improve walking. You take those out and you go back to just your original, that's your foot structure. That's what you are. You're not going to change that. So it's just a way to improve your gait. Yeah.
So I have a client that had a question for you, and she had talked about like the padding on the bottom of her foot, maybe that being kind of an issue. She has certain specialized shoe, or when she wears certain shoes, her foot becomes numb. I mean, talk a little bit about that. Is that maybe sound like maybe it's not the right shoe for her if the foot is becoming numb, or sore, tenderness on the bottom of the, I don't know what you call this part of your foot.
Yeah, the ball of the foot. Yeah.
The foot.
Yeah. So definitely one thing I would look at is her shoe, what type of shoe she's wearing. So she wants to use something that's not too soft. That's something more firm. That's going to do like a rocker bottom effect for her, because I don't know how old she is, but the older we get, we have something called a fat pad. That's right underneath the ball of the foot for a specific reason. That area gets a lot of stress, as well as the heel. So in those, as far as the foot, those are two areas where you have this thick layer of fat on purpose for shock absorption. So with time, that gets thinned down. And so that thinning of that fat pad, we call it fat pad atrophy, causes pain to the joints in that area because there's no more protection there. So you have to find something that's gonna replace that for you. And so, again, we go back to the type of shoe. You want something that's going to be firm and not too cushioned, because remember, that cushioning is it feels good, but it's not giving that stability to the joint. And so it's something I would recommend, something more firm and more like a rocker bottom effect that will do the bending of that joint.
Okay.
Even more specific, you know, inserts that have specific offloading to that area too are helpful. So then that those joints don't get too much stress.
Okay, awesome. That's super helpful. Thank you for that. So it sounds like just overall what we've been talking about is, you know, we can prevent and help avoid a lot of injuries by just choosing the right type of shoe when we're doing any type of active movement and maintaining that quality, keeping the quality of shoe when we're doing that. So we can, you know, not have those stressors or fractures or plantar fasciitis or kind of avoid some of those issues and then be able to tap into the right muscles and use the right ligaments and joint. I mean, all those things to be able to take us forward in life and keep those strong. So we're, I guess, fortunately or not fortunately, and not in the surgery room with you, having to get some things done.
I want to avoid that, yes, and
I
that's.
to avoid that, yeah.
I know how much you want to avoid that, Kara.
Exactly, awesome. So now my one other thing going back is people always have a hard time trying to figure out what is the right shoe. And a lot of people ask me, what shoes do you recommend? How do you kind of, is there certain brands that are best for supinated versus pronated
Yeah.
shoes? What would you say with that?
So one thing, so it's a little hard. I talked to you about a handout that I give my patients all the
Yeah.
time. It's very helpful, and I can have you so you can post it on your website and they can see that. But so, like I said, there's different brands that are I usually recommend. The top ones as far as athletic shoes, Asics, New Balance, Brooks. I like Hoka's, but each brand has different models. And so that's where you want to know if what kind of how is your heel strike when you land, do you tend to land outside, do you tend to land inside? So then that can give you an idea if you're overpronator or supinator. Those are the terms, overpronator and supinator. Usually you're one of those. Rarely do you see a neutral. You can see it. There's some people that are neutral, which is great, but usually you tend to lean somewhere. And for the untrained person, the only way you can see is kind of seeing how you wear your shoes, so then you can get an idea of what you are. Once you know if you're overpronator or supinator. By the way, I want to say that we all pronate and we all supinate, and we should. It's when you overdo it is the problem. And so we want to make sure that we don't overdo it, either left or right kind of thing, or up or down. So the shoe, once you know that, what kind of foot structure or the way you land, or if you have, you have flat feet, or if you know how you have high arches, then that model, there's every company, and you can find that on their website too. They have type of their models and what kind of foot structure flat feet. They're a little bit more basic terms. So for, basic population that wouldn't know the word pronation or supination, but you can tell with the models of what type of foot structure you have and will relate to that specific model. So for example, I said earlier, the GT2000 in an Asics is for an overpronator. But then there's other models that are for somebody that's supinates. So you have to really know what kind of foot you have, or the way you walk, so then you can see what kind of model in those brands. But those brands are if you're wearing one of those, you're already on on track, because then you have a good brand. It's just a matter of fine tuning it to what type of foot structure you have.
Okay, that's really helpful. And yeah, I will definitely love to share with everybody that flyer, or the card you have that kind of you give to your patients to help figure out what might be right for those different types of basically supinated, or whichever type of foot they have. So I will share that on my Facebook page. We have a Slave Fit Club fitness page on Slave Fit Club. You can like that. I'll post it there. I also have a LinkedIn page and can post it there as well. But I think this has been super helpful. I really appreciate you taking the time to go over this. I really think it is so important, and what I do and how I teach. And it's always nice to hear from a professional this reassuring that, those things are so important, and, there are things you can't avoid by taking care of your foot and having the right type of shoe when you're doing these activities. So
Yeah.
I really appreciate you speaking about this, and then we will share that information to our members and clients and fans.
Great. Yes. Well, thank you for inviting me, and it was definitely a pleasure. And I'm glad that you care about this because it's so important. And the more that we educate our clients and patients about how important it is to be able to be active once you're injured, and it plays a role in a lot of things, your mental health, and especially now being very active is so important for our mental health, since we're locked down a lot more. So
And Dr. Souliotis, if people wanted to come see you in regards to like maybe getting some special orthotics or having their own foot checked out, what tell us more about your locations, where you work, and all that, how they can get a hold of you.
yeah, so I work for Austin Diagnostic Clinic, and you can find me on the website, and on the link for this meeting, you can see where I'm at. But basically, I'm at two locations, north and south. North, I'm at North Austin Medical Center, and south, I'm at Circle C location. But you can go to our website, Austin Diagnostic Clinic, and look for podiatrists, and then there's several of us, and there's a location at Steiner as well. And you can see our what we treat, and we treat everything from injuries to foot reconstruction. So it's I've been practicing for 10 years here in Austin, and I love it. I love it because it's an active city, and so I get to see a lot of athletes and people that are always pro activity, and they want to be active, and so it's very fun to practice here.
That's very cool. Well, thank you so much again for your time, and we hope that everyone who's watched this finds that this is helpful, and we would love to hear your feedback if you find this helpful, or if you happen to have any further questions, I can pass them on to Dr. Souliotis. So thanks again. Have a great rest of your day.
Thank you, Kara. Bye.